The other day, Chris, a coworker of mine, mentioned that he was heading to the hospital to pick up his mother Mary and take her home. He explained to me that his mother had been admitted to the hospital for accidentally taking the wrong dosages of her medication, and this was actually the second time it had happened. Chris said that she's elderly, has difficulty reading prescription labels, and must take about 15 different medications daily. He concluded that he and his family would pay or do anything to prevent this from happening to their loved one. Ron, the father-in-law of my MBA capstone partner, Nick, who you'll see in just a moment, was diagnosed with leukemia just after he turned age 59. Ron was participating in a complex chemotherapy trial that involved numerous drugs with dosages changing frequently over a several-year period. 10 days into the trial, Ron was hospitalized for kidney failure as a result of an accidental overdose. Hi, I'm Michael Strassmaier, and on behalf of my WSU capstone team, the AutoMEDics, I would like to present to you AutoMEDS, a fully automated and networked medication dispensing system. Statistics show that patients regularly fail to follow prescriptions and end up taking the incorrect dosage of medication or even missing doses altogether on a regular basis. Failure to follow prescription information leads to poor health outcomes for the patient, anxiety for the family, and increased costs to the medical care system. According to a 2013 study conducted by the CDC, costs associated with medication non-adherence are estimated to be between $100 and $289 billion annually. 1 to 2/3 of medication-related hospital admissions are due to medication non-adherence. Contributing factors include poor physician-patient communication, poor patient attention, or even patient confusion. Our team, the AutoMEDics, is proposing a web-attached medication dispenser that will give the patient medication automatically based on the prescription. We call it AutoMEDS. How it works. A doctor writes a prescription that is electronically sent to the pharmacy. Refills are sent automatically. The pharmacy mails the medication directly to the patient in a special barcoded tamper-proof container. The patient simply inserts the medication dispenser into the AutoMEDS machine when they receive it in the mail. The automated dispenser links to pharmacies, physicians, and other care providers and is integrated with electronic health record systems to track all dispensed medications. It can also receive prescription changes over the web from the doctor or the pharmacy. The dispenser notifies the patient when to take medication through audio and light indicators and monitors the usage and will notify family members and others responsible for care when the medication is missed. Thank you for your time. Our next presenter will be Pete Curran, and he will discuss our value proposition, customer segment, and channels.
Thank you, Mike. When looking at the hard data for our 10 initial value proposition hypothesis questions, you can see that our gurus had positive, neutral, and negative response rates of 80, 14, and 6% respectively, while our customers had positive, neutral, and negative response rates of 87, 12, and 1% respectively. Our initial value proposition hypothesis for AutoMEDs was to address the problems of patients not adhering to drug prescription instructions, to the complexity of the drug regimen, confusing instructions, and or the patient's inability to remember when drugs are supposed to be taken. Initially, we included multiple features such as the easy load and automated sorting of pills, the connection of the machine to the internet to facilitate the update of medical records, as well as audio and visual alerts. However, we later added a feature to include the latest in encryption technology. This was after a California hospital was hacked. Their medical electronic records were hacked. That hospital later paid a ransom of $17,000 to retrieve that record. We also later included a tamper-proof seal. This was a feature to help prevent the theft of medications. And finally, we included Life Alert-like and interactive video add-on services to AutoMEDs. When looking at the hard data for our 11 initial customer segment hypothesis questions, you can see that our gurus had positive, neutral, and negative response rates of 96, 2, and 2% respectively, while our customers had positive, neutral, and negative response rates of 84, 7, and 9% respectively. Our analysis did confirm our initial hypothesis that the chronically ill, such as those with cancer, diabetes, and arthritis, and the disabled and or immobile population, and the elderly population would like to have the convenience of prescription drugs dispensed on a schedule. However, we did learn that it depends on the type of disability. For example, a immobile or disabled patient who is young and healthy is not a good customer for us and not a viable option for us. Additionally, we did notice some hesitancy based on the technology, such as video conferencing from our elderly population, which was to be expected. And finally, we did encounter what we deemed to be a fiercely independent customer who felt that AutoMEDs would actually inhibit his independence. We did feel that it was important to emphasize in the future that actually AutoMEDs would in fact foster increased independence and help to promote aging in place in the future for our customers. When looking at the hard data for our 10 initial channels hypothesis questions, you can see that our gurus had positive, neutral, and negative response rates of 80, 20, and 0% respectively, while our customers had positive, neutral, and negative response rates of 52, 20, and 28% respectively. Our initial channels hypothesis was that the three main product channels would be equally effective. Specifically, those were direct sales to the patient or end consumer, direct purchase from a hospital, and purchase of AutoMEDs as a product or service from a pharmacy. What we did learn was that directly marketing AutoMEDs to customers was a poor choice because it actually intimidated those customers. Additionally, we had learned the importance of actually targeting geographic market areas with a high elderly population. And finally, we learned that we really need to reach out with this product as a service, utilizing pharmacies, target caregivers, and other health providers. Thank you for your time. Our next presenter is Nick Gombos, who will be discussing customer relationships, revenue streams, and key resources.
Thanks, Pete. The first thing I'd like to present is our data we received from gurus and respondents in regard to customer relationships. You can see here that we have the hard numbers from our testing, and we had a very favorable response from gurus in our research in regard to customer relationships with over 80% favorable. And from customers, we had an over 86% favorable responses to our hypotheses. So our takeaways from our customer relationship studies were the fact that it's very important for our potential customers to build awareness and trust of our product through healthcare providers that they already had relationships with. So both gurus and respondents felt that it'd be very important for us to work cooperatively with their primary physicians and pharmacists and other healthcare providers to promote and build our customer base. Also, we learned that it would be important for our customer base to have certain add-on services to our product, and the most important three that stood out to us through our testing were some sort of a life monitoring service that could be incorporated with our product. Also, prescription security. Unfortunately, prescription pill abuse is on the rise, and this was very important to our potential customers for us to build in security for their prescriptions. And also some sort of video streaming support or resource for our patients and customers was very important to us building a customer base that trusted this product. The next testing we did was in regard to revenue streams, and you can see from both this slide and the next slide that we had actually majority unfavorable responses to most of our hypotheses. This really was actually beneficial for us to take another look and really reevaluate the revenue model for this product, fixed costs versus subscription, etc. So important takeaways from this were the testing of the elasticity of this product and also price sensitivity from our customer base. What we learned was that customers will actually be more flexible in regard to the one-time cost of this product as opposed to the reoccurring monthly subscription fees or add-on services, which was a little bit surprising to us, but good thing for us to learn. Also, we learned that both gurus and target customers were definitely responded more favorable to lower monthly fees, and like I mentioned earlier, were actually less opposed to a higher upfront cost. And I've tried to capture some of that data with these two graphs on this slide that show the relationship between positive responses and the lower monthly fees. We also tested key resources, and here's the hard data that we received from those hypotheses. You can see that the overwhelming majority of responses were favorable from gurus. We didn't test any customer hypotheses that week because we felt it more important to tap the expert knowledge for key resources. We focused on regulatory requirements, quality assurance, and also intellectual property concerns. And we learned that we would certainly need key resources in regard to medical insurance consultation. We definitely needed investor support to get this product launched. And also it came up in our testing that 24/7 product support would be critical for this product because it is a healthcare medical device, and we can't have customers without access to support when they need it. So that finishes up my portion of the presentation, and I'd like to introduce to you Will Burke, who will be covering key activities, key partnerships, and costs. Thank you.
Thank you, Nick. The key resources Nick mentions and our key activities are closely related. Here again are the results of our hypotheses interviews for these areas. We heard repeatedly throughout our study that the device needed to work and have backup capability. We have identified applicable device standards and expect to include independent auditors to confirm quality standards are met. We had mixed results regarding regulatory compliance, learning that regulatory compliance for dispensing is a pharmacy concern, but our gurus felt this topic may require further review as the machine is developed. Although both gurus and customers expected insurance companies to have a role in promoting and paying for AutoMEDs, we found that insurance companies are unlikely to cover the machine at this time. We confirmed that health plans and pharmacy benefit managers would be willing to participate in a demonstration project with the right partners. We had the pleasure of including the Executive Vice President and Chief Health Officer at CVS Health, a national pharmacy benefit manager, in our guru interviews. He indicated an immediate interest in a pilot and is looking to test technologies today. A 6 to 8% improvement in medication adherence would be expected to result in a significant savings to health plans. We added a patent filing key activity to protect intellectual property rights for AutoMEDs. We received overwhelmingly positive feedback on our partnership hypotheses as shown by our hard data results on this chart. As mentioned earlier by Pete and Nick, healthcare providers are key for promotion and distribution. We dropped regulatory agencies based on regulatory compliance activity feedback. We expect to partner with health plans and insurance companies, initially for a pilot, and then for insurance company coverage if the pilot demonstrates medication adherence improvement. We found that security and technology expertise would also be required, as integrating data into health records can be incredibly complex, and information security is of critical importance in healthcare currently. Finally, we confirmed that a joint venture and sales marketing arrangement would be the best approach to work with medical alert companies for distribution. In regards to cost structure, we confirmed the need for certain support costs, specifically a 24/7 call center, local pharmacy support, and centralized technology support groups would be necessary to support the device. We also reviewed options for manufacturing, and our gurus felt that partnering with an existing medical device manufacturer would be the most cost-effective way to proceed. Based on this, our gurus felt that the initial $500,000 investment was reasonable for this effort. This concludes our summary of the 9 building blocks. Back to you, Mike.
Thanks, Will. If Mary and Ron would have had the AutoMED system available to them and in use, they most likely would have taken the proper doses of their medications and would have avoided unnecessary hospital bills, much pain, and possibility of losing their life. I'm happy to report that they're both doing fine today. We see huge value in a definite position in the consumer market for AutoMEDs, as do our partners, customers, and the gurus that we question over our many weeks of analysis. We understand that we will have challenges and additional work to do with refining our revenue stream and with the refinement of the service and support model. We have some partnership opportunities to investigate, such as the demonstration project offer that was presented to our team by Dr. Brennan, the Executive Vice President and Chief Health Officer of CVS Health. We have not observed any barriers that we cannot overcome. We consider AutoMEDs a go. On behalf of Team AutoMEDics, I recommend proceeding forward with development and marketing of AutoMEDs. Thank you.